Good morning, this beautiful day in Prince Edward Island. Today there are three things really I'd like to focus on. One, our epidemiology, a little update on that, some self-isolation requirements, and the vaccine rollout. There is one new case of COVID-19 to report in P.E.I. today, an individual in their 50s who traveled outside of Atlantic Canada. This person was diagnosed based on routine testing. We currently have 7 active cases and 183 cases since the pandemic began. Canada reported an average of over 7,800 new cases per day in the past week. Since the pandemic began, the country has recorded over 1.2 million cases and 24,000 deaths. Case rates continue to be highest among those aged 20 to 29 and lowest among people over the age of 80. As many provinces are dealing with the crushing impact of the third wave of COVID-19, hospitalizations and ICU admissions continue to increase. For many age groups, the number of hospitalizations in the past week were the highest recorded since the pandemic began. The proportion of hospitalized individuals with COVID-19 that require intensive care continues to increase and is now over 18%. The high demand for hospital and intensive care is not surprising given the variants of concern are becoming the dominant strain of COVID-19. The variants are more transmissible and create more severe illness, creating additional strain on health systems around the world. COVID-19 and its variants continue to be on the move and are spreading faster than ever before. 2 of our recent cases have been identified as the variant B.1.617, first detected in India. And we have a total now of 15 B.1.1.7, the variant first identified in the United Kingdom. The virus can spread very quickly through casual contact and be in a person's system basically for several days without any symptoms. And that is why sometimes if we test too early, we will not detect the virus. Hence, the regimen to be tested multiple times is very important. Here in Atlantic Canada, we see firsthand how quickly COVID-19 can get out of control. In the last week, almost 900 new cases were reported in the region, and currently there are 1,153 active cases of COVID-19. Our thoughts are with our friends, family, and colleagues in Nova Scotia as they work hard to get COVID-19 under control in their province. There are 943 active cases in Nova Scotia, and as of yesterday in that province, over 40 people are in hospital, including 8 in intensive care. It is concerning to hear that younger, previously healthy people are in ICU with severe symptoms of COVID-19. The situation in Nova Scotia is serious, reminding us of the importance of being vigilant and taking steps to keep the virus out of P.E.I. Island residents should not travel off island unless it is absolutely necessary. People should not travel to our province unless it is for an essential purpose. Individuals traveling to P.E.I. are legally required to self-isolate. Since the pandemic began, almost 23,000 households have successfully completed 14 days of self-isolation. And I know I mentioned this last week, we are taking steps to tighten our measures around self-isolation. Self-isolation is key in containing the spread of COVID-19 and its variants. And almost 70% of our cases of COVID-19 are directly linked to travel. And we know that being an island, we are at great risk of importation of COVID-19. Since the outset of the pandemic, non-residents applying to come to P.E.I. under all travel streams had to document and submit a self-isolation plan as part of their pre-travel approval application. Effective today, all P.E.I. residents who must travel outside of P.E.I. are asked to register their self-isolation plans online before they return to the province. This registration process will help individuals develop plans that meet our self-isolation requirements. Ideally, it is recommended that individuals isolate in a location that is totally separate from others. Isolating completely away from others reduces the risk of transmission to anyone else. However, it is recognized that some individuals do not have access to a separate isolation location, and they cannot put measures in place to limit all contact with others in their household for 14 days. There is a risk of transmission when someone is self-isolating with others who are not required to self-isolate. However, the risk can be reduced when the self-isolator and everyone in the household follows the rules. The registration form for island residents to register their self-isolation plans will be live this afternoon. I urge islanders who are returning home from out of province travel to register their self-isolation plan. It will be reviewed, and if there are any questions, you will receive a phone call or an email. If there are no questions about this plan, you will receive a letter of confirmation. You should bring this letter with you and show it to the border screener when you enter the province. Not all island residents returning home have to register a self-isolation plan. Rotational workers and truck drivers, families involved in travel for parenting purposes, and those who are work isolating do not have to register a self-isolation plan. P.E.I. residents who travel off-island on a same-day trip and are planning to be eligible for the same-day self-isolation exemption are also not required to register a self-isolation plan. There should be one isolation plan registered per household, not one for each individual. Individuals who do have to self-isolate with others may be subject to an enhanced testing regimen. We recognize the next few days will be a transition and some island residents will be arriving home and will not have had an opportunity to register their self-isolation plan. In these cases, individuals will be asked to provide details about their isolation plan after they arrive in the province. These new measures, along with other restrictions announced recently, will help us keep COVID-19 out of P.E.I., and if someone does have the virus, they will be detected early. Some of the other recent changes include the requirement for a pre-arrival test for people arriving from outside Atlantic Canada, restricting travel coming to P.E.I., including seasonal residents, limiting same-day travel exemptions, enhanced testing and compliance checks for people in self-isolation, rotational workers and truck drivers self-isolating until they receive their first negative test, and work isolators waiting for their first negative test before going to work. Put simply, all these measures are really trying to limit the importation and the spread of COVID-19. We are trying to keep islanders safe. We continue our slow, steady march to immunize island residents. The focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible. As of Saturday, May the 1st, 56,104 doses of vaccine have been administered, including 10,648 second doses. 34.1% of adults over the age of 16 have received at least one dose of vaccine, and 8% of island residents have received 2 doses of vaccine. Nationally, P.E.I. is on par in terms of the rate of when you look at the vaccines that have been administered, and we have the highest rate of second doses administered when you look at how P.E.I. compares to other provinces. We remain on track to vaccinate at least 80% of individuals aged 16 years and older with at least 1 dose of vaccine by the end of June. Based on the forecasted vaccine supply, we expect the second doses will be administered to those over 16 years of age and older by September. It is important that everyone receive 2 doses to ensure that they have sustained protection from COVID-19. In the next 2 months, over 83,000 doses of Pfizer vaccine are expected to arrive in P.E.I., along with almost 46,000 doses of Moderna vaccine. In keeping with our plan to immunize people quickly, 12 community pharmacies will be administering Moderna vaccine. In May, the supply to pharmacies will be initially limited and will increase in June as our supply increases. The week of May 17th, a few thousand doses of Moderna product will be available through pharmacy to adults aged 50 years of age and older. Visit the P.E.I. COVID vaccine webpage and click on Partner Pharmacies to book an appointment at a pharmacy closest to you. During the week of May 24th, anyone age 40 and over will be eligible to book an appointment at a partner pharmacy as well. Health Canada is reviewing data from Pfizer and is expected to lower the age for this product, allowing youth aged 12 to 15 to receive the vaccine. It is our expectation that this age group will also be able to have 2 doses of the vaccine before school resumes in September. By mid-May, we are expecting national direction regarding second doses for individuals under 55 years of age who received AstraZeneca as a first dose. In the coming weeks, we expect to receive a small shipment of the Janssen vaccine, a single-dose immunization that can be stored in the fridge. Discussions are underway regarding the best use of these 1,250 doses. We will have enough mRNA vaccine, the Moderna and Pfizer products, to immunize all islanders. We remain focused on our objective of having 80% of eligible island residents immunized with 2 doses of vaccine. P.E.I. fares well in comparison to other provinces in terms of testing per capita. We have tested 904 people per 1,000 population compared to the Canadian average of 836 tests per 1,000. In the past week, 5,254 tests were completed in the lab and 675 rapid tests at the points of entry. Thank you to the staff at the testing clinics and the provincial lab, staff who have met every challenge presented by COVID-19. Thank you to the thousands of island residents who have been tested for this virus. Some of you have been tested many times. Testing is a key element of our provincial response to COVID-19, allowing us to identify cases early. Detecting cases early ensures that we can take steps to break the chain of transmission and limit the spread of COVID-19 in our province. I am very concerned about the evolving situation in Atlantic Canada and the rising prevalence of variants of concern. My colleagues have indicated that the variants spread like wildfire, and we can certainly see that across the country. And as we look across the country and around the world, there really is a race between the variants and the vaccine. And we need to buy time here on P.E.I. to get more people vaccinated. Now more than ever, it's important that we continue to respect the public health measures and follow the rules. If you are required to self-isolate, it is essential that you respect the requirement, and please follow your testing regimen. If anyone has symptoms of COVID-19, please arrange to be tested. Working together, we will win this race, and we've talked about it before, it feels like a marathon. And as we continue our journey and buy more time to get more islanders immunized, let us continue to be patient and continue to be kind. Thank you. To you, Marion.
Thank you. Good morning, everyone. Well, people continue to come out in high numbers to receive vaccines at our clinics as we inch closer and closer to that goal of vaccinating 80% of the population over the age of 16 by the end of June. That's a milestone we're all looking forward to, and our vaccine program will continue until everyone has access to their second dose of vaccine. This week, individuals aged 30 to 39 are able to book their vaccine appointments according to their birth month, and this began yesterday. So as of today, May 4th, individuals aged 30 to 39 born in the months of January through June are able to book their appointments. And beginning tomorrow, individuals born in the months of July through September, and on Thursday, May 6th, the individuals born in the months of October to December. Next week, the vaccine appointment rollout will extend to the remainder of the eligible population, including adults aged 18 to 29 and youth aged 16 and 17, according to their birth month. This group is also broken down into 4. So beginning Monday, May 10th, individuals born in the months of January through March. And on Tuesday, May 11th, individuals born in the months of April through June. And on Wednesday, May 12th, people born in the months of July through September. And on Thursday, May 13th, individuals born in the months of October to December. Appointments can be booked directly online using our online booking system at princeedwardisland.ca/getthevaccine. This is the quickest way to book your appointment, and it is very easy, and it's also available 24 hours a day. Those who aren't able to book online can call our booking line at 1-844-975-3303 to speak to a booking clerk. An appointment is required to receive your vaccine at a community clinic for all individuals. I do want to reassure everyone again that we will have appointments available for you all, and you will all have the opportunity to get the vaccine by the end of June based on our current supply projections. Open appointments are available at the moment, and more will be added as more doses are confirmed to arrive. If you're unable to attend your appointment for your vaccine, or if you choose to get a vaccine at a pharmacy instead, please reschedule using the online platform or calling the 1-844 number. You receive an opportunity to do that with your reminders for your appointments. Remember that those who have booked an appointment will be receiving an automatic appointment notification with your second dose appointment within the coming weeks. You do not need to call the 1-844 booking line to book your second dose appointment, and we ask that you not book your second dose appointment online. We will automatically send you your appointment. I want to thank everyone once again, especially our vaccine rollout teams and our swabbing and testing operations teams who continue to do amazing work. To all members of the public, thank you for keeping our island community and healthcare system safe by following the public health measures. And thank you to those who are being vaccinated to keep yourselves and others safe. I want to wish everyone a pleasant weekend this upcoming weekend. I know there's a special occasion on Sunday, and I'll wish Dr. Morrison a happy Mother's Day coming as well this weekend. And so happy Mother's Day to all Islanders who are mothers this coming weekend. Thank you.
Thank you. And now we'll open it up for questions. I actually almost forgot it was Mother's Day.
The weekend's coming.
Exactly. So we'll open it up to questions from the media.
Brittany Spencer, CBC.
Hi there. Yes, my first question is for Dr. Morrison. I was hoping to get some more details about the two cases that have been identified as the variant, first identified in India. I'm wondering if you can tell me if those two cases are in the current active caseload and how concerned you are now that P.E.I. has now seen cases of two of the variants.
Hi, Brittany. So I think, first of all, I'm not surprised to see additional variants. We know that the UK variant is certainly the predominant variant that people are seeing in the country. I think there are 127,000 cases of the variants of concern reported in Canada, and the variant that was first identified in India is called a variant of interest, and it's being seen in different parts of the country as well, so it's not unexpected. We, of course, we do know that the individuals who have been impacted by this particular variant are in isolation, and each one of these cases reinforces that how important it is that people do isolate so it doesn't spread to other people. And even if they don't have symptoms or very mild symptoms, you need to follow those isolation requirements to protect other people. And so I believe they are part of the active case count.
Okay, thank you. And my second question is about, I guess, fines and enforcement. There have been a number of fines over the past several days for illegal entry into P.E.I., large gatherings, and you mentioned, your concerns about how quickly variants in particular can spread. So I'm wondering if you're looking at increasing penalties or fines at this time.
Hi, Brittany. I know there has been certainly more discussion in the media about some of our enforcement fines. I think we have certainly the enforcement colleagues, our conservation officers, our police services have issued a number of fines, and they followed up different complaints and issued warnings as well. It has been asked, and we are looking at what an increased fine schedule could be, but I think the important part is actually following these rules that are put in place, not only to protect individuals, but our community. And I'm most concerned with that happening and doing all the other things we just mentioned here in the briefing in terms of tightening up who's coming to the province, those isolation plans, the compliance around testing. That's probably really important. So, but it is something that has been raised in terms of that fine structure that is under the Public Health Act.
Okay, thank you very much.
Dave Stewart, The Guardian.
Good afternoon to you both. I guess my first question would be, in reference to, I guess, the messaging on the vaccines from the top all along has been to get the first vaccine offered to you. Now, the messaging around vaccines such as, AstraZeneca and Johnson & Johnson is they're only recommending them for specific age groups and that they come with a risk, albeit a very small one. Do you feel people in this jurisdiction, P.E.I., which isn't a hotspot at this point, is still to wait for the Pfizer or Moderna or take the first shot available to you?
Hi, David. I think that's a really good question. We've had others ask that in the last few days as well. NACI, the National Advisory Committee on Immunization, certainly saying that if you have low or very low epidemiology in terms of COVID disease in your region or in your province, that the preference is to wait for an mRNA vaccine, and then you can choose, if you're in certain age groups, to have the a viral vector vaccine, and that would be your AstraZeneca or Janssen product. Earlier, if you feel that you cannot wait for the mRNA vaccine. And so we're in that position here that we do not have an epidemiology that says that we should have an earlier or younger age for that viral vector vaccine at this point in time. We've realized how quickly that can change in Nova Scotia, and they adjusted their age of AstraZeneca accordingly in the last number of days. And the studies certainly show that AstraZeneca and the viral vectors vaccines can decrease your chance of hospitalization and severe outcome. But they also recognize that there is a risk benefit because of a rare but devastating side effect that can happen or that they've seen a signal of with the viral vector vaccines. So we're going to have enough vaccine for the mRNA vaccine for all islanders, but if anything changes and we need to adjust the age for our viral vector vaccines, we will.
Thank you for that. I guess my follow-up question would be, and I know we're still early in the game and days feel like years at this point, but with you mentioning that you expect all eligible islanders to receive their second dose by September, do you think we'll reach something resembling herd immunity by the fall? Could we be looking at lifting the mandatory mask policy? Just what's your opinion of what things might look like this fall? And I realize we haven't even reached the bubble yet, but just curious about that, your opinion on that.
Yes, and I think we are all looking forward to that time. So I think certainly the first goal is to get eligible islanders vaccinated with one dose, and then it's really important that we get people vaccinated with 2 doses, and we'll have enough supply during the summer. So by the end of August, 1st of September, we should have second doses into our, really, hopefully everyone 12 years of age and older before going back to school. And we will be looking at exactly that, Dave, in terms of the public health measures. We know every modeling thing that we look at, all the studies are saying we still need to keep some of these public health measures in place until we have our population as protected as much as we can, that we have less disease pressure in the country. And I do think both of those things will happen by the fall. And then we will be able to adjust some of these public health measures. And more evidence coming out about we need to do so slowly in terms of easing up a lot of these restrictions, and so that we don't want to have another resurgence or a fourth wave going into the fall. So, but you talk about some days feeling like years, et cetera, and that's certainly the case, I know, for Marion and I and so many other people in the province. So the sooner we can start lifting these restrictions, but doing so in a safe way once the population has been protected as best we can, so we don't have large numbers of people in hospital or having bad outcomes related to COVID, we will be looking forward to that day, and I'm hoping that it will look a lot better in the fall.
Thank you, and happy Mother's Day to you both.
Thank you, Dave.
Louise Martin, CBC.
Hi, good afternoon. I'll start with Happy Mother's Day so I don't forget after I ask my question. So Happy Mother's Day to you both. My first question is about AstraZeneca. And when I spoke to a pharmacist, says that the over 55s are just not booking their appointments. There's still quite a bit in stock, and they're worried about wasting the doses they have now as they expire at the end of the month. Is there any consideration of sending shots, if there's any left over, to other jurisdictions who are in desperate need?
Hi, Louise. I think it's a good discussion. We actually have been speaking, our office has been speaking to the Pharmacy Association this week, and they raised that as well. And so that is a discussion. We are conscious of the fact that in Nova Scotia, things change so quickly within a week that if that was to happen here in the next week, we would want to make sure we had AstraZeneca available so that if we needed to reduce that age down, like Nova Scotia did, we'd have some extra AstraZeneca available. So we're just trying to gauge a little bit about what could happen here and balance that with wanting to make sure that we don't waste any AstraZeneca. So those discussions are certainly part of our thinking as we go forward in the next few days.
You got to be, I guess, watching the clock and the expiration. I suppose that's
exactly.
a balancing act. I just wondered about, the pause on travel to P.E.I. for seasonal residents until May 17th. So we do know that some have already arrived, and many are now applying. What are the latest numbers on how many are already here, how many have applied for after May 17th? And is there any consideration, are you still comfortable with that May 17th date, or could that be extended?
Well, we'll definitely will be extending that to May 17th date, but we are trying to work on some of the language and the communication with our Office of Public Safety as well. I don't have any of the numbers here exactly of in terms of the applications, Louise, but we can certainly get that for you today or this week. And we've recently looked at all the numbers as well, and where the seasonal residents arrived from last year. But certainly the intention is to extend that date of May the 17th, and that's really has to do with what's going on in our own region as well as the rest of the country, and we will welcome them, and they will be going through our quarantine when it's time to do so. But it's certainly right at this point in time, we're trying to limit the number of people coming into the province, and also asking island residents not to travel if they don't need to.
Sorry, did I miss a new date then, not the 17th?
There's not been a date set, but I anticipate that. I know the date will be extended, and we're just finalizing that date.
Gotcha. Thanks so much.
Yeah.
Appreciate that. Happy Mother's Day again. I remember.
Thanks. Yes.
You too, Louise.
Gabrielle Drummond, Radio-Canada. Good afternoon to you both. Ma question, c'est en français pour la docteure de Morrison. Vous avez déjà répondu ça en anglais, mais j'aimerais l'entendre en français, s'il vous plaît. Alors, vous avez dit que 2 des récents cas qui ont été signalés ici à Lille ont été causés par le variant indien. Alors, c'est la première fois qu'on signale ce type de cas ici à Lille. Alors, est-ce que ça vous inquiète le fait qu'on ait signalé ce variant ici maintenant?
Bonjour. Alors, ça m'inquiète, mais c'est pas surprenant vraiment qu'on a ici le variant B1617 qui est un variant d'intérêt vraiment. Et on a les 2 cas, on vient juste de savoir. Mais ça arrive partout au pays. On a beaucoup de variants. La majorité sont le B117 qui vient de Grande-Bretagne. Mais alors, c'est pas surprenant, mais ce qui m'inquiète en plus est que si quelqu'un ne s'isole pas comme il faut. Parce que si c'est le COVID-19, c'est la même n'importe quel variant que c'est tellement important que ça ne transmet pas entre personnes si ils isolent comme il faut. Alors, c'est vraiment ça qui m'inquiète plus qu'un variant à un autre.
Parfait. Bon, ma prochaine question, c'est par rapport au passeport vaccinal, parce qu'on sait que le gouvernement fédéral travaille sur la création d'un passeport pour les voyageurs. Alors, vous, personnellement, Dr. Morrison, est-ce que on sait que ce passeport vaccinal, il soulève beaucoup de questions éthiques. Est-ce que vous, personnellement, est-ce que vous défendez la mise en place d'un passeport vaccinal ou vous pensez que ça serait une mesure pour limiter la liberté de certaines personnes?
Je pense que c'est une bonne question. Je sais qu'il y a c'est partie d'une grande discussion nationale pour avoir un passeport pour les voyages internationaux. Je sais que les personnes qui sont vaccinées sont plus protégées et puis les personnes qui sont vaccinées sont moins capables de transmettre le COVID à quelqu'un d'autre. Alors, on participe aux discussions. On ne fait pas une décision ici. Finalement, on veut qu'on protège. C'est vraiment le but maintenant est de protéger à la majorité des insulaires à l'île du Prince-Édouard avec les 2 doses de vaccin. Mais on n'a pas pris une décision provinciale ou même fédérale à propos d'un passeport de vaccination.
Parfait. Merci beaucoup.
Merci.
Et bonne fête de mère à vous 2.
Merci beaucoup.
Allison Jenkins, The Guardian.
Hi there. My question is for Dr. Morrison. I'm following up on a note from a trucker coming across the bridge, and he sent a note out to other truckers to say kind of don't carry any unauthorized passengers because they're enhancing checks on checking trucks, basically, at the border crossing at the bridge, the Confederation Bridge specifically. So I have wondered, have several questions on this. Just wondering what the process is for checking the trucks for unauthorized passengers.
Hi. So the border screeners ask, certainly I know they're trying to make sure they ask all vehicles, including trucks, is there anybody else in the vehicle? And as part of the screening questions, so that's one part of it. Certainly public health, working with their highway safety and enforcement colleagues, can check vehicles. We as has been in the media, there have been some recent charges related to people being in vehicles coming into Prince Edward Island. And I think it certainly raises some of the questions about wanting to make sure that we have a very good process in place with our border screeners, but that is in conjunction with our enforcement colleagues and highway safety as well. So it's something that certainly can happen and maybe happening more in the weeks ahead.
So how do they decide what trucks to check? And are they checking the cab and the cargo area?
Allison, those are certainly the good detailed questions that really are being, I think, finalized between our border screeners who are doing the screening and our enforcement colleagues, exactly which vehicles are being inspected for other passengers or not. But they are all getting asked if there's anybody else in the vehicle.
Okay. And so do these people who are asking the questions and or checking the trucks, like, I'm just worried, like, I'm asking, do they have the authorities? Does everyone there have the authority to ticket someone? Because there have been charges laid or tickets issued.
So the under the Public Health Act, the screeners do have the authority to check the vehicles, and the enforcement has the abilities to issue a charge or issue the fine.
Okay, and I guess thinking of the safety of the people checking on these things, is there, you say that the procedure's in development, but is that part of it as well? Like, it seems kind of perhaps scary to have to do that.
Absolutely, and I think that's why it's really a combined discussion to make sure that the process is very clear and consistent and for everyone involved.
Okay, and one last question, is this part of the enhanced border screenings?
Well, when we've talked about enhanced, well, there's been a lot of enhancements, I think, lately, but so one of the things that we've been talking about is the enhanced checks around those who are needing to be tested. So every day, people who are supposed to be tested, we can determine if people have been tested. Almost everyone coming into P.E.I., whether you're a truck driver, rotational worker, work isolator, compassionate, or returning from travel are all on testing regimens of some kind. And it's really important that we've talked about that. So trying to make sure that that people are being tested and tested when they're supposed to be is part of that enhancement. We certainly are asking, trying to make sure that the border screeners are asking the questions they need to ask, giving people the information they need at the borders. And then we've talked about the enhanced testing at the points of entry, certainly at Borden, and the goal to have point of entry testing both at Wood Islands and at the airport as well in the weeks ahead.
Okay, and I do have one more question, but I forget, and I will let it rest.
Okay.
Thank you very much for your time.
Okay, that's great. Have a nice day, everyone. Thank you.